UNM Sandoval Medical Center Rehabilitation Center treats common injuries involving the spine, shoulders, elbows, wrists, hands, hips, knees, ankles, and feet. But for us women, things can be a little different. So joining us now to tell us more about women's health physical therapy is women's health physical therapist Brooke Connell-Foster. Thank you for coming in.
My pleasure. Thank you.
So tell us a little bit about women's health physical therapy.
Okay, women's health physical therapist, also known as a pelvic floor physical therapist because we see men as well, is a physical therapist that is specialized in treating the dysfunction of the pelvic floor. And the pelvic floor, just in short, is just a network of muscles and connective tissue that is located in the saddle region or the nether regions.
Yes. Something I'm very familiar with being pregnant, so okay.
That's right. That's right. And its role is to support pelvic organs, maintain the structural integrity of the pelvis, and to help with continence. So it keeps your fluids and your solids where it needs to be till it's appropriate to release.
Very important. Now, how is a pelvic floor therapist different from other physical therapists?
So a pelvic floor therapist is a physical therapist. It can be an occupational therapist too, but I won't go into that. Okay. But it's a board certified physical therapist that has had additional training in the pelvic floor specifically. Now it can range from a 3-day like weekend course to a year-long residency program. Most of us kind of fit in the middle of that. Our local PT program at UNM offers a 10-week rotation. Okay. In women's health. That's what I went through, and it was amazing, a lot of hands-on work. So.
Okay, now what are some of the common issues that you guys treat? You mentioned a few of them, but.
Yes, so incontinence is the big one, both solids and liquids, and that means just like the involuntary loss of those.
Yeah.
And it can range from what we call stress incontinence, so coughing, sneezing, laughing, and having a little leakage, to urgency, which is that gotta go kind of sensation and kind of losing it on the way. We also do pelvic pain, which is very broad, can hit anything.
Okay.
And pelvic organ prolapse, which is just organs falling down to places they shouldn't.
That is terrifying.
Our holes, yes.
Okay, now, what are some signs that we should be going to see you guys?
Okay, so as early as possible. A lot of ladies and men, they have these issues and they think, oh, I'm just going to keep it secret, or oh, it's not that bad. Let your primary care provider know about them as soon as they happen, because they'll do some special tests to make sure it's not something scary. Yeah. But if it's not something scary, then ask them about physical therapy for the specific issue. Okay. Because then they can write a referral for us.
Now, how can people find more information on UNM Sandoval?
So UNM Sandoval, on the website, we have our, the therapy, the rehab section, and it lists all the things that we do there. But all the major hospitals have outpatient physical therapy clinics affiliated with them. Like Presbyterian has the Healthplex, UNM has Sandoval Regional, it has also UNM Maine. Okay. And just find out, you can either go online and find out where the rehab place is, call the front desk, ask for a women's health specialist, and usually the front desk person knows that we're there.
Got it.
If they're kind of confused, then they probably don't have a women's health therapist.
Okay, well, thank you so much for
coming
in and sharing
pleasure.
this with us. And if you want a link to their website, we will have it at casa.com.